Catching diabetes during pregnancy can be very stressful and sometimes scary too. It can lead to various complications such as premature delivery and depression. Not just for you, but it can also affect your baby to become overweight. At 24 to 28 weeks, your doctor might get you to drink a very sweet sugary drink, then have your blood taken. This is to test for your glucose tolerance or test for gestational diabetes. Gestational diabetes is known as glucose intolerance and insulin resistance. Basically, it's diabetes that develops specifically during pregnancy. Gestational diabetes can affect anyone, even if you're healthy and exercising regularly. Now, to make sure that you understand what triggers gestational diabetes, let's look at some of the factors that are linked with it. Firstly, vitamin D has a negative correlation with gestational diabetes, where if your vitamin D level decreases, your risk of gestational diabetes increases. Secondly, women who are overweight or have obesity before pregnancy are at a higher risk. Thirdly, age can also be a factor. Women aged 25 and older are more prone to gestational diabetes. Recurrence is quite common. Gestational diabetes recurs in about 30 to 69% of subsequent pregnancies. Gestational diabetes may lead to serious complications for both you and your baby. Based on a study of over 7 million pregnancies, women with gestational diabetes tend to have increased odds of preeclampsia, C-section, and preterm delivery. All these issues can lead to detrimental impacts on your baby, including underdeveloped lungs, breathing difficulties, underdeveloped immune system, and overall health problems. A study with 218 women showed that women with gestational diabetes can be at risk of depression, anxiety, and stress. Life is tough enough with someone kicking you from the inside. On top of that, women with gestational diabetes have higher risk of fetal macrosomia, where your baby is basically born larger than average and being overweight. It can be difficult for bigger babies to pass through the birth canal, where the shoulders can become stuck while the baby's head can pass through. This can make the labor process difficult and traumatizing. The good news is gestational diabetes only affects between 5 to 25% of pregnancies. So it is not that common, and I hope you are safe from it. If you wonder what you can do to manage it, the American Diabetes Association recommends nutritional counseling, not by anyone, but by a registered dietitian. They will set up a medical nutrition therapy with you, where they'll have to look at your height, weight, and put you on a strict diet. They might suggest the use of non-caloric sweeteners, limit eating carbohydrates, or they might suggest insulin therapy. Physical exercise can help, but if you have or are at risk of gestational diabetes, getting the right treatment is very important to prevent negative effects on your pregnancy. If you know anyone that is pregnant, please click the share button and send it to them. If you yourself are pregnant, watch other videos on our channel to feed your brain about pregnancy. Be sure to click the subscribe button so we can keep you up to date on the science of pregnancy.